It's 8 a.m. from Fox 35. This is Good Day Orlando.
We're talking about deadly implants.
That's right. There is a scary new report out this morning linking breast implants to a rare cancer. A local doctor is in the house to explain the risk just ahead. All right, Kristen, thanks so much. 8:17 is the time. We do have this health alert. It is all new this morning, a deadly link between breast implants and cancer. The FDA now reporting 9 women have died from a rare form of cancer connected to the implants. The FDA says it has received more than 350 reports of the cancer associated with the implants, and doctors say this type of cancer is usually treatable, so that is some good news, but still pretty disturbing. Board-certified plastic surgeon Dr. Soto is here to talk more about this breaking health news with us this morning. Dr. Soto, first of all, thank you so much for being with us.
My pleasure, Dan.
You know, this is very scary because there are a lot of women who consider breast implants after children, or for whatever reason they want to get these implants, right? Is there a specific type of implant that is associated with this cancer risk, and why are we just kind of hearing about this now?
Well, absolutely. You know, it does sound very concerning, but I think that after I give you a little bit of knowledge, you'll see it's really not that big of a deal for most women. So, first of all, we're just learning about it ourselves, and that's why I think it's only coming out in the media at this time. It's a very rare cancer called breast implant-associated anaplastic large cell lymphoma. So very rare.
Long name, but...
Exactly. So most people call it BIA-ALCL. If you consider the millions of breast implants that have gone into women over the past 40 or 50 years, that's really an extremely small fraction of patients who have experienced this. There's only been a couple of hundred people worldwide. And it really only seems to be associated with breast implants that have a textured surface.
I was going to ask if there was a specific type of implant. So what does textured surface mean as opposed to any other type of implant?
So I think that bears emphasizing. As of now, there is no confirmed report of a BIA-ALCL in a patient who had a smooth surface implant. So broadly speaking, there's 2 types of breast implants, whether they're filled with saline or filled with silicone. Some have a smooth surface, so it's kind of like a water balloon, if you will, and some have what's called a textured surface. So the surface is kind of pebbly, almost like it has sandpaper on its surface. And the idea when those were designed was that it would prevent the implant from moving around, and it would lower the risk of capsular contracture where the scar tissue got firm around the implant. That seems to not really be as big of a benefit, excuse me. So I think that in the big scheme of things right now, it's really only the textured surface implants that are a concern.
Right. So I know that you said this is rare, but if you are one of those women, doctor, who has this textured implant, you're very concerned. What should you do if you have this textured implant?
Well, first of all, I think it's important to know that the risk is higher the older that your implants are, or the longer it's been since they were put in.
Okay.
So I think that it's important, first of all, to understand that no breast implant should be considered a permanent device. We should all understand that sooner or later they're going to need to be replaced, and the average lifespan is going to be around 10 years. So I think that it's important to have careful follow-up with your surgeon. I ask my patients to return to see me annually.
Every year?
Every single year, and I tell them it's important enough for me to see you that I don't even charge you for those visits. I want to see you, I want to make sure you're doing okay, because I might be better at figuring out there's a problem than you will. And the second thing I think is important for people to understand is how most people figured out that they had an issue with BIA-ALCL, and that is many years after their implants were put in, they found a lump or they had a lot of swelling or fluid. And that's the most common way they were found, is a late seroma is what we call that, where there's fluid surrounding your implant many years after the implant was put in. And that certainly, I think, should prompt a visit to your doctor.
Very interesting. So at the end of the day, see your doctor if you have any concerns. And we brought you in to talk about something else, but we thought this was so important that we had to touch base. We've only got about 30 seconds, but I do want to talk about this, and it is on a much lighter note. The next health headline, it's called Protox. It's a new trend, right, where people are getting Botox to look more professional.
Right.
Is this really happening?
Yeah. You know, I think it's a slightly different use of Botox by people who believe that minimization of facial expression is going to benefit them in their professional life. So, you know, professional gamblers or on a more everyday level.
So they don't want to have any expression whatsoever.
Right. They don't want the people they interact with professionally to understand what they're thinking or feeling. So, you know, I read about a psychiatrist who had a hard time not displaying delaying judgment on her face when she was talking to her patients, and she felt like it was hurting her relationship. So she wanted a little bit more Botox than we would normally do to kind of freeze her expressions and give her a better poker face, if you will.
So Protox is Botox to the extreme.
I think so, yeah. And I think, I think that if you're properly motivated and you understand the risks, it's okay. But I think that because it is a more aggressive use of Botox, it's important to, you're walking right up to the line and looking over the edge. And I think it's important to understand the risks there.
You're looking over the edge if you can actually have enough expression to see that you're kind of teetering over the edge with this Protox. Dr. Armando Soto, thank you so much for joining us.
Pleasure.
We certainly do appreciate your
Thank
good
you.
advice. Thank you.
Bye.